Well, since I'm just beginning my residency this upcoming year, a lot of the experiences that I've had have been as a medical student. And one of the memories that sticks out to me the most is when I was in Guatemala as a volunteer in a small hospital there. And one night, a pair of brothers showed up after a very serious motorcycle accident. The first brother, very limited injuries, but the second came in and he was vomiting, he was unconscious and had a big hematoma or swelling on his head, and we were really concerned that he had bleeding inside his brain just based on his clinical condition. We decided we needed to give him a breathing tube so he could maintain his breathing and send him to a hospital with better capability. The nearest hospital that had treatment he needed was over 2 hours away in the capital city. And myself and a nurse from the hospital went with him in the ambulance to take him to this hospital. We got him to the hospital, and we were very satisfied that he was given care that he needed. They had an intensive care unit there, which was very impressive considering this was in Guatemala, and felt that he maybe had the opportunity to survive. And the rumor going around town was that he had passed away due to his injuries. And obviously that was very disappointing with all the effort we had put in the night before to keep him alive, to receive the next level of care. And the difficulty was to convince his family that he did have a chance and it was worth the cost and the emotional expense of sending him away from the community. Hearing that news, I decided to call the hospital in Guatemala City to see what the details were. But it turns out that he was actually still alive, and all the rumors were false. And within a week, he was speaking and was able to walk out of the hospital. It was just such a great feeling to be able to play a small role in a story like that, to be able to tell the brother of this man who was still in our smaller hospital that his brother was in fact still alive and that it had turned out okay in the end. Really made a difference, and really it was one of the things that convinced me that emergency medicine was a career that I thought I would want to dedicate myself to for the rest of my life.